Hi, I'm Isabel. I'm going to be doing heparin titration. I am first going to be checking my orders here. I have my patient, Jordan Taylor. Their provider ordered them a heparin infusion. The concentration is 25,000 units and 250 milliliters. It is going to be a titration, an IV titration, and it is due now. I'm going to just quickly check some things about my patient. So some labs, I'll check that their platelets are above 5,000 and that they have an appropriate PTTI in our time. I have my heparin protocol sheet here, and it says that the PTT has to be over 79 seconds and the platelets are over 50,000. I said 5,000, over 50,000. I'm also checking that they do not have a history of heparin-induced thrombocytopenia. I'm checking that they do not have any allergies to this medication, and I'm checking that they didn't have an ischemic stroke or were administered TPA in the last 24 hours. Okay, so I've checked their labs, I've talked a little bit about contraindications. I'm also going to make sure that there is an order for protamine available from the provider, because that is the antidote if they were to overdose on this medication. Alright, so now I'm going to collect some supplies. I have alcohol swabs, I have my infusion set, I have some saline injection, and so that I can flush my line if needed, and then I'm going to go to the Pyxis, and I'm going to get out my medication. So I'm going to do a safety check here. I'm going to just confirm what I have pulled with the screen. I have heparin infusion, 25,000 units and 250 milliliters. It is an IV medication, so I'll be titrating this to the desired therapeutic effect, and it is due now. It is not expired. I'm checking to make sure that there's not any particulate matter, that the packaging has not been tampered with. I'm also doing the same for my saline flushes and my alcohol swabs, as well as my infusion site here. Alright, and now I'm going to go to my quiet place. I'll do another safety check here. I have my patient, Jordan Taylor. They're getting a heparin infusion for their DVT. They are getting, the concentration is 25,000 units to 250 mils, and the dose is going to be based off of this titration therapy protocol. They currently have it has like the standard heparin infusion that we're going to start with, the 14 units per kilogram per hour, and then the loading dose as well. It is due today, Wednesday at 11:46, and it is going to be an IV medication. I checked their labs for their CBC, platelets, PTT, and creatinine. They have no documented allergies. I talked about the contraindications, and I checked the expiration date on all of my supplies here. So now I'm ready to go into my patient's room. Hand hygiene. My name is Isabella. Yours. Infusion, name and date of birth for me, please. Okay, excellent. I'm double checking that with my mark here. Alright, so Miss Taylor, I have your heparin infusion. This is for your so now the infusion has been stopped. Progress to
all that's been good.
I have to hang this up on my
final vital signs check to take allergic reactions the entire time.
Something called
And so now I will begin doing time to ensure that I said turn that you're
Alright, thank you so much, Jordan. I hope this is not going to bust
before I get started, if at any point you start to feel any sort of signs of an allergic reaction, please refer to
just before we get started, have you had
So I'm going to
stroke, or when you get TPA in the last 24 hours, and do you have any allergies?
Right, that is lower.
No. Okay, excellent.
That is low. Okay, so now
There's a
we have this
bleeding
whole light
focus
right here.
medication, so it's really important.
I would also want to make
that
sure
you do not
to
get out of bed or have a fall,
remove
so
the IV
please
from
keep
her.
it right if you need anything.
So,
Also, if you notice
my gloves on.
pink urine or blood in your stool, or
So after removing the IV here, I would want to make sure to dispose of all of my items right away.
if you feel any symptoms of allergic reaction coming on, or any breath itching, anything like that, also please let me know. I'll stay with you for the first couple minutes of the infusion just to make sure that everything is ready. And there shouldn't be a problem, okay? So do I have your permission to proceed?
All right, so then I'll make sure to alcohol swab. And normalize it for seconds. And I want to put
Alright, so like I said, this medication is based off of your clotting time, so we're gonna have to draw your labs every 5.5 hours to just assess how the therapy is going.
so I begin my standard exit.
But we're just gonna get started with our initial standard infusion first. So I'm gonna do some hand hygiene here.
She has her collar.
Apply some clean
I'm not going to go
gloves. This is an IV medication, so you're just gonna assess the site first.
Are you in a comfortable position? You have all of your items.
Have you had any trouble with your IV?
So I would dispose of all of these items to the hospital policy. And so now when I leave, I would want to make sure to document the blood component and amount. If she had any adverse reactions, the patient tolerance procedure, education that I gave, and my vital signs.
I'm just going to assess the IV for patency.
You got it. Okay, that wasn't too bad. But it's just, it's like a lot of things. Okay, one thing I want to say is not like, yeah, I'll just rewatch it and do my thing. Okay, I will.
They wanted us to dry. I take off the packaging
I was
and prime
the client's still open.
Saline
It was
flush.
still going a little bit, and I was like, oh god. But thankfully, because this is not having to do like pressure, but it started like dripping out. I was like, oh, let's do this.
push. 3 to 5 milliliters. Okay, excellent. And then I'll get a new Curis cap and just attach that. So I've assessed for patency. The IV is working, so that's good. Alright. So now I am just going to I'm just gonna prime my bag here so that it's ready to go after I do my bath. I opened up my tubing here. I'm just going to take a look at it and make sure that it is on plant and that there's no damage. I can see.
Yeah,
Since it has take off. And be really careful not to let the end fall on the ground. Sure, it's all unplanned. I might phone a friend, grab some extra tubing. Okay. So just while my friend is grabbing that for me, I'll take off my gloves and do some hand hygiene. And perfect. I'll do some hand hygiene again. Put on some clean gloves. Perfect. Thank you so much. Okay. And once again, make sure that this is all clamped here. I would take this out of the packaging, inspect for any damage, and check back for shipping. This has the sterile cap on it, so I'm not contaminating it. Discard this tubing, take off the cap. I'm ready. I'm gonna change my gloves, do some hand hygiene, and now I can do my. Alright. So, my patient, Jordan Taylor, they are 70 kilograms. The standard infusion is 14 units per kilogram per hour. So I have 70 kilograms, and that is going to be multiplied by 14 units over 1 kilogram, and times the concentration of the medication. So we want 250 milliliters over 25,000 units. And that is going to be running for 5.5 hours, but I'll just start with 1 hour first. So then I will just do my calculation here. Okay, so we have 70 times 14 times 250 divided by 250,000. Okay, so that is 9.8 mil per hour. I'm doing that over 5.5 hours. And that is going to give me 53.9 mil. And then I'm going to calculate my bolus, which according to the sheet here is 60 units per kilogram. So I have my 60 over 1 kilogram multiplied by my concentration. Alright. 70 times 60 times 250 divided by 25,000. And that is a bolus of 42 milliliters. According to hospital policy, that is going to be given over 3 minutes. And now I'm going to calculate my total to be infused, the VTI. 42 milliliters of a bolus plus 53.9 milliliters total. 9 milliliters total. Okay, 95.9. Now total. Yankees. Okay, excellent. So now I am going to call my second nurse to come and check this with me. Okay. Hello. I am getting, I have my patient, Jordan Taylor. They have heparin infusion of 250,000 units per 250 mils. The standard infusion is 14 units per kilogram per hour. Going to be giving that over 5.5 hours. They're getting an IV infusion. This is due now, and they have a bolus amount of 60 units per kilograms. This is the titration table that was ordered, and I just need a double check on the math with you. Okay, let me go ahead and do that. So for the standard infusion, I have 70 kilograms times 14 units over 1 kilogram. And then I multiplied that by the concentration. So I ended up getting 9.8 milliliters, and then I multiplied that by 5.5 hours, and my ending volume to infuse over 5.5 hours is 53.9 milliliters. Okay, it's right there. Let's double check, and then for the bolus.
Okay, let me do that. Oh, it's right there.
Here, yeah.
Oh, this is the different.
Mm-hmm.
For 95.9.
Okay, so I have for the bolus 70 kilograms times the 60 unit that's ordered times the concentration, so that gives me a 42 milliliter bolus. You agree? Okay. And then for the total volume to be infused, you add the bolus to the initial volume, 53.9, and you get 95 milliliters total to be infused. You agree?
Yes.
Okay, excellent. Because this is a high alert medication, I just have to make sure that my second nurse checks that for me. I do need you to check the settings. I'm so sorry. So I'm just going to scan my patient and scan my medication very quickly here. Okay, so can I just have your name and date of birth one more time, please? All right, excellent. I'm going to do some hand hygiene. I'll apply some gloves. And just another check. No allergies to drugs that you're aware of. Check the labs. Different contraindications. My med. I have the green light there. Okay. So now I'm going to. So I'm going to channel select. I have the word drugs. And I'm going to weight-based dosing. This is 25,000 units and 250 ml. It's just asking me to confirm that. I'm going to enter the patient's weight, which is 70 kilograms. Next. So I'm going to enter the dose 15 units per kilogram per hour and the total volume to be infused, which is 95. Oh, 95. Okay, excellent. So do you agree with those settings? I have the dose. The rate is 9.8 mil per hour. It's going to be running for 5.5 hours, so I have 95.
Yep, that all looks good.
Okay, great. And I'm going to do the bolus. So the dose for this is 60 units per kilogram. Per hospital policy, it's going to be over 3 minutes. There's also a safety on this that will not allow me to do that for less than 3 minutes. So we have the bolus dose at 60 units per kilogram. And the patient weighs 70 kilograms and it's going over 3 minutes. Rapid bolus. Okay, excellent. Thank you, second nurse. So now I'm going to clean. So we have the bolus running right now at 42 milliliters, that is correct, 60 units. So that's going to run for 3 minutes. I'm just going to stay with my patient, make sure that everything is all good during this time. I'm going to take off my gloves, do a hand hygiene. I will document assessment of the IV site, how the patient tolerated it, the dosing, the rate, and 5.5 hours has passed. I'm going to take their next blood draw and I get back their PTT as 72 seconds, so according to my protocol here, so 61 to 78 seconds, we're going to do a bolus of 40 units per kilograms and we're going to increase the rate by 2 units per kilogram per hour. So I'll just do that math really quick. So 2 units increase, that's going to be 16 units, so 70 kilograms times 16 units over 1 kilogram times the concentration. Okay, and I'm just going to use my calculator here. So 70 times 60 times 250. Double check. Divided by 25,000. Excellent. So I have 11.2 mils. That's going per hour. That's going to be infusing over 5.5 hours. so the total volume for the standard infusion, 61.6 milliliters. I'm going to recalculate my bolus here. So 40 times 70.
Alright, so say, this point, so you take a look at it. Right now, starting it at
1,000.
and
I'm going to multiply that to 50 divided by 25. Yeah, 1,000. So 28 mils. Okay. So I have a standard infusion, total volume over the 5.5 hours of 61.6 milliliters, and my bolus is 28 milliliters. And now I'm just going to call back over my second nurse. And I've educated my patient that the little beep means that the bolus has finished infusing and they're ready to go. Okay, I have Vocera, my second nurse. And I'm just gonna check on my patient, make sure that they're doing okay. Do some hand hygiene. Sure. Yes. Okay. So I have another licensed RN here. Okay. So I have my PTT results back. 72 seconds. So we're following this protocol right here.
72, so. And what's the patient's weight?
70 kilograms.
Okay, let me see. So. Is that what you got?
For the bolus dose, and then the rate adjustment is 2 units per kilograms per hour. The initial rate was 14 units per kilogram per hour. I've had to use these over and over again.
Perfect.
Okay, excellent. So I'll just confirm with you. So I have an 11.2 milliliters per hour rate for the new rate. And that's going to be over 5.5 hours. So that comes out to 61.6. And then I have the bolus as 40 units per kilogram times 70. And that is going to be 28 milliliters.
Yeah, I got that.
Okay, excellent. All right, excellent. Thank you so much. And now I will just adjust my rate here while my second nurse is still in the room. Okay, so I'm gonna hand hygiene. All right, so we've got your PTT results back. I'm just going to adjust the rate now on your infusion. So we, like I said, are going to titrate to the desired effect. So I'm going to channel select. I'm going to adjust my rate here. I'm just going to pause. Okay, so I'm adjusting my rate to the 11.2 milliliters. and that shows that it adjusted the dose here to the 16 units per kilogram, and I just confirmed that with my second nurse. And the total volume to be infused, I'm going to just add my bolus to my standard infusion. 0.6. Okay. So then that's gonna run for 5.5 hours. And I have my other registered nurse here. Do you agree with the standard infusion?
Yes.
Okay.
Perfect. Thank
Excellent. Now I'm going to set my bolus. So the new dose for the bolus is 40 units per kilogram, and that's going to be over 3 minutes. And I'm just going to confirm with my nurse.
you. Yes.
Okay.
Perfect.
Excellent. Okay, so that's 28 milliliters. Yeah, the bolus volume to be infused is the 28 milliliters here. Okay. All right. So the bolus volume to be infused is 28 milliliters per solid units per kilogram, and that's going to run for another 3 minutes. Just going to check in on my patient, see how they're doing. I have their bed in the low locked position. Gonna make sure that they are comfortable before I leave the room. Do they need anything? Do they need to go to the restroom? Do they have any pain? Do they have everything nearby them? I'm gonna make sure that their call light is within reach, that there's Keros caps on all of the exposed parts of their IV. And then I'm going to do my hand hygiene, let them know that I'll just be right outside of the room documenting, clean up everything. I am going to document that the rate was increased per the titration table protocol. I'm going to document how the patient is tolerating it, and that I will be back to do another draw in about 5.5 hours to double check everything, and I'll make sure that they are all good. I'll check back in on them in about an hour. Okay, thank you.